When we enter into a surgical room or an operation theater, we will be overwhelmed by the presence of so many doctors within the theater. Imagine the position of the anesthetist who has to stand in the middle of a lot of surgeons, assistants, uh, assisting in anesthesia. Whenever they have to feel for pulse, it becomes very difficult for them to look for the pulse in the radial artery. So what they do is they usually prefer some of the peripheral vessels for feeling the pulse. All those vessels are being named as anesthetist artery, right? So they are referred to as anesthetist arteries. One such important artery lies right over here, and that is our facial artery. In this session, we will learn about the facial artery, its anatomy, as well as its clinical significance. The learning objectives for this session are, at the end of completing this session, you should be able to list what are the arteries supplying the face, describe the origin, course, branches, area of distribution, and clinical significance of the facial artery, describe the venous drainage of the face and its clinical significance. Let's begin with the names of arteries that supplies the face. Face is supplied by two important arteries. These are the facial artery, which forms the chief arterial supply. Then we have the transverse facial artery, which is the second artery supplying the face. The third artery is some of the cutaneous arteries that follow or accompany trigeminal nerve. So remember the names. Most important, facial, then transverse facial, and of course then few cutaneous arteries, small arteries accompanying trigeminal nerve. Let's try to learn more about the facial artery. Any artery, when you learn, you need to learn these under these following headings. For example, you begin with origin and then mention how the artery terminates. Then describe the parts, if any, course, then branches, what is the area it supplies, and if there is clinical significance. For any artery in the body, you can use these headings. So let's begin with the discussion of facial artery. Facial artery is the chief artery that supplies arterial blood to the face. What about the origin? The facial artery takes its origin from the external carotid artery. Fine? External carotid artery, as we know, is a branch from common carotid. The external carotid artery, let's imagine we have the hyoid bone at the level of the second cervical vertebra. Just in front of the tip of the greater cornea of the hyoid, we have the carotid triangle and the external carotid artery. The facial artery arises slightly above the tip of the greater cornea of the hyoid bone in the carotid triangle. Origin of the facial artery is from the external carotid artery just above the level of tip of the greater cornea of hyoid bone. This will help in dividing the facial artery into two parts. So the part which lies in the neck region, right? And then the part which is present in the face. So the parts of facial artery are, it has a cervical part which is present in the neck, and then it has a facial part. Right? So let's see how the cervical part enters the face. So this is what we will learn in the course. Let's not worry about the course of the cervical part. We will focus mainly on the course of the facial part. After the origin from the external carotid artery in the carotid triangle, above the tip of greater cornea of hyoid, the facial artery is present in the digastric triangle. Then it enters the face by winding around the lower border of the mandible or base of the mandible. Then when it reaches the face, the course becomes tortuous. It lies about at a distance of 1.25 centimeter from the angle of the mouth, then ascends over the side of the nose and ultimately ends in the medial angle of the eye as angular artery. Fine. So origin from the external carotid, termination as angular artery. Throughout its course, it is divided into two parts. So this is regarding the course of facial artery. What about the branches then? The facial part gives off a branch close to the lower lip. This is referred to as inferior labial. Labial refers to lip. So this supplies the face below the lower lip. Then slightly above, it gives a superior labial branch. As the name suggests, this supplies the region above the upper lip. Then close to the ala of the nose, it gives off one more branch. This is called as lateral nasal branch. Inferior labial, superior labial and lateral nasal branch, and at the termination we refer it to as angular artery. So these are the branches of facial artery. What about the area of distribution then? As we learned just now, the labial branches supplies the facial area around the oral cavity, and the lateral nasal branch supplies the area over the nose, the dorsum, the lateral part, everything. So we have some part of the face that is left over, which is supplied by the transverse facial artery. Right? This is regarding the area of distribution. What about the clinical significance then? We said that the facial artery enters into face by winding around the lower border of mandible. Now at this region, the facial artery is carried or it is crossed by one important nerve. Now this nerve is the marginal mandibular branch of facial nerve. Now why is this important? Imagine you have an abscess over the lower border of mandible and you want to drain it by incising the skin. If you incise at this area, now what is the precise location of this? This is also referred to as the antero-inferior angle of masseter. So at the level of antero-inferior angle of masseter, the facial artery is crossed by marginal mandibular branch of facial nerve. If you incise skin over this area, it will invariably result in sectioning of the nerve and paralysis of all the muscles of the face present around the lower lip. Right? So this is why you have to be very careful while incising the area over or the skin over the base of the mandible. One. So the first important clinical significance is its relation to marginal mandibular branch of facial nerve. The second thing is, as I said, this artery is also known as anesthetist artery. Why exactly so? At the antero-inferior angle of masseter, you can actually feel for the pulsation of facial artery. Now the question is how you can do it. If you want to do it in a living individual, ask the person to clench his teeth like this, which will make the anterior border of masseter prominent. Then you can feel for the pulsation of facial artery exactly at the antero-inferior angle. Right? So this is the second most important clinical significance of facial artery. It is used by anesthetists to feel for peripheral pulsations. Fine? So this is regarding the detailed anatomy of the facial artery. What about the other arteries supplying the face? As I said, one more artery that we have is the transverse facial artery. The transverse facial artery is located close to the lateral region of the face. This is the superficial temporal artery, which is one of the terminal branch of the external carotid. From the superficial temporal artery, we have an artery referred to as the transverse facial artery. So this is our transverse facial artery. So transverse facial artery is one of the arteries supplying the face. It arises from the superficial temporal artery. What about the course? The important course that you may want to remember is this passes between two structures. Okay? Easy to remember. Above here you have the zygomatic arch and below here you have the parotid duct. This is the classic relation of the transverse facial artery. It passes between these two structures. Right? So this is regarding the course of transverse facial artery. Then what about the branches? Transverse facial artery gives smaller branches which will supply the area over cheek, and then they will anastomose with the main branches coming from facial artery. So branches and area of distribution of transverse facial artery. The smaller branches which arise from this will anastomose with branches of facial artery supplying the lateral part of the cheek or the face. Is there any difference between the course of transverse facial artery or the facial artery? One important thing we need to remember about facial artery is the entire course of facial artery is highly tortuous. Right? Why? Now this is because whenever we contract our facial muscles, the artery gets stretched. If the course of the artery is straight, there is every chance that the facial artery will get torn. Right? This is the reason why the course of the facial artery is highly tortuous. That is one important difference between the course of transverse facial artery and facial artery. Right? So this is regarding the transverse facial artery. Once we have learned the arterial supply, let's learn about the venous drainage. The venous drainage of the face is by two important veins. These veins are, one is the facial vein and the other one is the retromandibular vein. We have learned this in the discussion of the topic of scalp, but this will be a revision for us. Let's begin with the facial vein. Fine. How exactly the facial vein begins? We have the supratrochlear vein, then we have the supraorbital vein, which will unite to form a vein referred to as the angular vein at the medial angle of the eye. Then the angular vein will continue down as the facial vein. This is how the facial vein is formed. Right? Then the other important vein that I said is retromandibular vein. Okay? We have the superficial temporal vein. Then we have the maxillary vein, which will unite behind the mandible, forming the retromandibular vein. The retromandibular vein, after some course, divides into an anterior division and posterior division. Why we need to know this? The anterior division will unite with the facial vein, forms as the common facial vein. So this is common facial vein. The common facial vein will ultimately drain into the internal jugular vein. Okay? We have the posterior division of retromandibular vein, which will unite with a vein behind the ear, which we refer to as posterior auricular vein. Joining of these veins will result in the formation of a vein called as external jugular vein. What is the fate of the external jugular vein? The external jugular vein will ultimately drain into subclavian vein. This is how the venous blood from the face or scalp gets drained into the larger veins of the neck. Right? So this is regarding the venous drainage of the face. What about the clinical significance of this venous drainage? We'll draw it again. So can you tell me what is this vein? Angular vein. And what is this? The facial vein. Right? And we have a dural venous sinus in the head, the cavernous sinus. Okay? So let's say this is the cavernous sinus. The cavernous sinus is connected with the facial vein by two roots. What are the two roots? One is the superior ophthalmic vein. Right? The other root is we have a plexus of vein in the lateral pterygoid muscle. So what is that? The pterygoid venous plexus. The pterygoid venous plexus is connected with the facial vein through, this is our deep facial vein. Right? Then the pterygoid venous plexus is connected with the cavernous sinus through emissary veins. Now, why we need to know all this? Part of the face which covers the lower half of the nostrils and the upper lip. This area is referred to as the dangerous area of face. Why it is referred to as the dangerous area of face? Any infection from this region can spread to cavernous sinus. What are the routes? Of course, it is through this ophthalmic veins or through the deep facial vein, then into pterygoid venous plexus. Through the emissary vein, the infection can spread to cavernous sinus. So this is why the venous drainage of the face assumes clinical significance, because infection from the dangerous area of the face can easily spread to cavernous sinus through these routes, ophthalmic vein as well as deep facial vein. This is regarding the clinical significance of the venous drainage of the face. To quickly summarize the blood supply of the face, arterial supply of the face is by a tortuous facial artery which arises from the external carotid just above the tip of the greater cornu of the hyoid bone. And also, it arises from the transverse facial artery, which is a branch of superficial temporal artery. Both the arteries will supply the entire extent of face. The course of the facial artery is tortuous because it allows for stretching of the artery during the movements of the facial muscles. Regarding the venous drainage of the face, we said there is a facial vein, then there is a retromandibular vein. The fate of the facial vein, as we discussed, will unite with the anterior division of retromandibular vein, will form the common facial vein and drain into internal jugular vein. Whereas the posterior division of the retromandibular vein will unite with the posterior auricular vein, forms the external jugular vein and opens into what? Yes, the subclavian vein. The clinical significance of the venous drainage, we said there is the area of the lower part of the nose and upper lip, which is referred to as dangerous area, because infection from this area can spread to where? To the cavernous sinus. How? Through the ophthalmic veins or through the deep facial vein, pterygoid venous plexus and emissary veins. Regarding the clinical significance of the arterial supply, the facial artery is felt at the anterior-inferior angle of the masseter and it is crossed by the marginal mandibular branch where it is more prone for injury. This is regarding the facial vessels and its clinical significance. That's it for this session.